Welcome to another video of Clinical Hematology Unit 2. Red Cell Disorder. Unit 2, Red Cell Disorders. 1. Erythrocytic disorders. Erythrocytic disorders refer to conditions affecting red blood cells, RBCs, which are crucial for carrying oxygen throughout the body. These disorders can result from abnormalities in the quantity, quality, or function of RBCs. 2. Hemoglobin, its structure and function. Hemoglobin, Hb, is a protein found in red blood cells responsible for transporting oxygen from the lungs to the tissues and carbon dioxide from the tissues to the lungs. Structure. Hemoglobin is composed of 4 polypeptide chains, 2 alpha chains and 2 beta chains, each bound to a heme group. Each heme group contains an iron atom that can bind to oxygen. Hemoglobin has a quaternary structure and undergoes conformational changes when oxygen binds, aiding in the efficient uptake and release of oxygen. Function. The main function of hemoglobin is oxygen transport, but it also helps in the transport of carbon dioxide and maintains the pH balance of blood. 3. List of normal and abnormal hemoglobins. Normal hemoglobins. HbA. Adult hemoglobin composed of 2 alpha chains and 2 beta chains. It is the predominant form in adults. HbF. Fetal hemoglobin composed of 2 alpha chains and 2 gamma chains. It is the predominant form in fetuses and newborns, but it decreases after birth. HbA2. A minor component of adult hemoglobin, consisting of 2 alpha chains and 2 delta chains. Abnormal hemoglobins. Hemoglobin S. HbS, a mutated form of hemoglobin found in sickle cell anemia. It causes the red blood cells to become sickle-shaped under low oxygen conditions. Hemoglobin C. HbC, an abnormal form of hemoglobin caused by a mutation that results in hemolytic anemia. Hemoglobin E. HbE, a mutation in the beta-globin gene that can lead to mild anemia. Hemoglobin D. HbD, an abnormal form of hemoglobin associated with mild hemolytic anemia. Hemoglobin H. HbH occurs in alpha thalassemia and results from the accumulation of beta chains. 4. Hemoglobinopathies and thalassemia. Hemoglobinopathies. These are inherited disorders of hemoglobin structure, resulting in abnormal hemoglobin molecules, such as sickle cell anemia, HbS, hemoglobin C, and hemoglobin E. Thalassemia, a genetic disorder characterized by reduced or absent production of one of the globin chains of hemoglobin. There are 2 main types. Alpha thalassemia, caused by a mutation in the genes responsible for producing alpha globin chains. Beta thalassemia, caused by a mutation in the genes responsible for producing beta globin chains. These disorders can lead to severe anemia and require regular blood transfusions. 5. Polycythemia. Polycythemia refers to an increased number of red blood cells in the bloodstream, leading to thickened blood and increased risk of clotting. There are 2 types. Primary polycythemia, polycythemia vera, a rare bone marrow disorder that leads to overproduction of red blood cells. Secondary polycythemia, caused by external factors like chronic hypoxia, low oxygen levels, which stimulates erythropoiesis, production of red blood cells, to increase oxygen delivery to tissues. 6. Define and classify anemia. Anemia, a condition in which there is a deficiency in the number or quality of red blood cells or hemoglobin, resulting in reduced oxygen delivery to tissues. Classification of anemia. By etiology. Iron deficiency anemia, caused by insufficient iron for hemoglobin production. Vitamin B1-2 or folate deficiency anemia, caused by insufficient vitamin B1-2 or folate for red blood cell production. Aplastic anemia, caused by failure of the bone marrow to produce red blood cells. Hemolytic anemia, caused by premature destruction of red blood cells. Anemia of chronic disease, caused by underlying chronic conditions, such as infection, inflammation, or cancer. By morphology, size and color. Microcytic anemia, characterized by small red blood cells, e.g., iron deficiency anemia. Macrocytic anemia, characterized by large red blood cells, e.g., vitamin B1, 2, or folate deficiency. Normocytic anemia, characterized by normal-sized red blood cells, e.g., anemia of chronic disease. By pathophysiology. Regenerative anemia, the bone marrow compensates by increasing red blood cell production. Non-regenerative anemia, the bone marrow fails to increase red blood cell production appropriately. MCQs VVI. 1. Which of the following hemoglobin variants is most commonly associated with sickle cell anemia? A. HbA. B. HbS. C. HbC. D. HbE. Answer: B. 2. Which of the following hemoglobin types is predominant in fetuses and newborns? A. HbA. B. HbF. C. HbA2. D. HbS. Answer: B. 3. In thalassemia, which of the following is the main pathological feature? A. Abnormal hemoglobin synthesis. B. Reduced red blood cell production. C. Excessive iron deposition in tissues. D. Excessive destruction of red blood cells. Answer: A. 4. Which hemoglobin is most commonly found in individuals with beta thalassemia? A. HbA. B. HbA2. C. HbF. D. HbH. Answer: C. 5. A patient with an elevated red blood cell count, increased hemoglobin levels, and a history of chronic lung disease is most likely suffering from which type of polycythemia? A. Primary polycythemia. B. Secondary polycythemia. C. Hemolytic anemia. D. Aplastic anemia. Answer: B. 6. Which of the following conditions is primarily caused by a deficiency of iron in the diet? A. Macrocytic anemia. B. Sickle cell anemia. C. Iron deficiency anemia. D. Aplastic anemia. Answer: C. 7. The accumulation of beta chains in alpha thalassemia leads to which of the following abnormal hemoglobin types? A. HbS. B. HbA2. C. HbH. D. HbC. Answer: C. 8. Which of the following best describes the quaternary structure of hemoglobin? A. 2 alpha and 2 gamma chains. B. 2 alpha and 2 beta chains. C. 4 alpha chains. D. 2 beta chains and 2 delta chains. Answer: B. 9. Hemoglobin E is most commonly associated with which of the following conditions? A. Thalassemia major. B. Sickle cell disease. C. Mild anemia. D. Hemolytic anemia. Answer: C. 10. Which of the following describes the function of hemoglobin? A. Transporting glucose in the blood. B. Carrying oxygen and carbon dioxide. C. Synthesizing red blood cells in the bone marrow. D. Regulating blood pressure. Answer: B. 11. Which of the following is a hallmark characteristic of microcytic anemia? A. Increased mean corpuscular volume, MCV. B. Small red blood cells. C. Normal-sized red blood cells. D. Decreased reticulocyte count. Answer: B. 12. A patient with beta thalassemia will most likely have which abnormal hemoglobin component? A. HbS. B. HbA2. C. HbF. D. HbH. Answer: B. 13. Which of the following hemoglobinopathies results in the production of hemoglobin that is less soluble in low oxygen conditions, leading to sickle-shaped red blood cells? A. Hemoglobin D. B. Hemoglobin E. C. Hemoglobin S. D. Hemoglobin C. Answer: C. 14. In the classification of anemia, which of the following is characteristic of normocytic anemia? A. Small red blood cells. B. Large red blood cells. C. Normal-sized red blood cells. D. Increased hemoglobin concentration. Answer: C. 15. The pathophysiology of anemia of chronic disease typically involves A. Increased destruction of red blood cells. B. Failure of the bone marrow to produce sufficient RBCs. C. Excessive iron absorption. D. Defective hemoglobin synthesis. Answer: B. 16. What is the primary cause of aplastic anemia? A. Autoimmune destruction of red blood cells. B. Genetic mutation in the hemoglobin genes. C. Failure of bone marrow to produce red blood cells. D. Deficiency of vitamin B1-2. Answer: C. 17. What is the most likely consequence of polycythemia vera if untreated? A. Anemia. B. Increased blood viscosity leading to thrombosis. C. Excessive bleeding. D. Hemolysis of red blood cells. Answer: B. 18. Which of the following is not a common cause of secondary polycythemia? 7A. Chronic hypoxia. B. Pulmonary diseases. C. Renal tumors producing erythropoietin. D. Genetic mutations in hemoglobin genes. Answer: D. 19. The most common presentation of hemoglobin C disease includes which of the following? A. Severe anemia. B. Splenomegaly and mild hemolysis. C. Hemarthrosis. D. Polycythemia. Answer: B. 20. Which of the following describes the appearance of red blood cells in iron deficiency anemia? A. Microcytic and hypochromic. B. Macrocytic and hyperchromic. C. Normocytic and normochromic. D. Sickle-shaped. Answer: A. Thank you so much for watching. If you found this video helpful or interesting, don't forget to hit that like button. It really helps out the channel and lets me know you want to see more content like this. If you haven't already, subscribe and turn on the notification bell so you never miss a new video. And hey, feel free to share this with your friends or anyone who might benefit from it. Your support means the world to me.